Well, good afternoon, everyone. My name is Sixto Cancel, and I'm the founder and CEO of Think of Us. I'm just so excited to be here talking with you all today. Today is a moment where we're gathering to learn a little bit more about kinship. As folks know, a lot of folks have been talking about kinship, and so Think of Us is collaborating with the Harvard Performance Lab to go ahead and share a little bit of information. So, one, I want to say, we're excited to be here. The most important part of gatherings like this is to come together. So, you have CDSS who's in the room. Thank you to Casey Family Programs, and thank you to the Kennedy School Government Performance Lab. And I'm going to pass it over to our folks on the Government Performance Lab to share a little bit about the work that they have been doing, the genius that they are bringing to the work. And so I'm excited to pass it to y'all.
Thanks so much, Sixto, and good afternoon, everyone. We're so pleased to have you with us today. My name is Linda Blancato, and I'm a director of our Child and Family Wellbeing Initiatives at the Government Performance Lab. I'm joining you today from Raleigh, North Carolina. I also have two of my wonderful colleagues with me who lead our team's work with jurisdictions to strengthen Kin-First practices. Emma and Shireen, can I ask you to say a quick hello as well?
Yes, definitely. Hi, everyone. I'm Emma Craig. I'm a project leader at the GPL, and I'm based in Charleston, South Carolina, but I hope that the San Diego folks on this call will let me say I'm a temporary resident, part-time San Diegan, as well as I've been working with the team there on a Kin-focused project, so wanted to give them a shout out as well. Shireen, I'll pass it to you.
Hi, I'm Shireen Ashley. I am a fellow at the GPL. I am based in New Jersey, the lifelong Brooklynite. I'm going to steal Emma's monitoring that. And I will be monitoring and sharing in the chat today.
Thank you both. In the next hour that we have together, we're hoping to offer some ideas and tools and resources to support you all in your county's journey to build a Kin-First system. Rochelle, if you're able to share the slides, that'd be great. Awesome. On the next slide, we have a bit of an overview of the series that we'll be leading for the state of California throughout the rest of this month. We invite you all and your colleagues to join as many of these sessions as feel interesting or relevant or work for your schedule. A little bit of what we're hoping to cover today. First, we want to start off with a little bit of an introduction to our team and our work at the Government Performance Lab and why we're really focused on strengthening kinship care. We also hope to share with you 6 Kin-First actionable strategies that you can be using with your teams to increase and support placements with kin. We want sort of today's session and all 4 of these sessions to feel really practical and valuable for your teams. And to be thinking about how can we support you in translating these ideas and concepts into action. So we do want to spend a bit of our time today helping you think about how can you craft your communication strategies to really be emphasizing the benefits of kinship care across stakeholders within your county teams or external audiences, and think about the framing and the messaging that may really resonate for those different stakeholder groups. To preview a little bit of what's to come, next week, our session will focus on ways that you can better understand and be using your data on kinship placements. Following that, thinking about strategies for working with your families and working across program teams to be making more placements with kin. And then finally, we'll close out with a session on how to be thinking about how to set those placements up for success by offering caregivers proactive supports to resources available in the community. So we'll come back to this and share all the registration links at the end of the call today. Let's turn to the next slide. And as we're getting started, I just want to share a little bit more about who we are at the Government Performance Lab and our work around kinship care. We are an applied research organization based within Harvard's Kennedy School. Our team, as you've heard, is spread throughout the country, and we're working with state and local government agencies really focused on what does it take to build more just and effective service systems for their communities. Our work, though, is really hands-on and implementation focused. Our team is working alongside agency staff like yourselves to be developing and testing new approaches to learn what works really supporting teams through key implementation decisions and milestones, thinking about things ranging from how can government be spending money through procurement in ways that are really oriented towards results and help advance agencies' equity goals, to how we can be incorporating community voice in designing solutions. Our team is able to draw from our direct work with more than 100 jurisdictions to be capturing insights and tools and practices from that work that we can then share with agency leaders and staff around the country, including through creating spaces like this that we have today for peer-to-peer learning. On the next slide, I want to hand it over to Emma to share a little bit more about why our team is really focused on supporting jurisdictions in their work to strengthen their kin first practices and strengthen supports for kin caregivers. As we know, so many agencies are really reimagining what does it look like to serve children and families.
Thanks, Linda. So at the GPL, we really believe in the importance of prioritizing kinship care to preserve what belongs to every child, their family, their culture, and their community. And some of the potential benefits for children placed with kin are listed at the top of the slide. Things like it can reduce trauma, can lead to better mental health outcomes and greater placement stability. And I just want to be really clear, when we talk about building a kin first culture, we're not just talking about finding that one relative to take placement. We are talking about supporting all the ways that kin and nephrons can remain involved in that child's life during this tough time. So maybe that's respite, transportation, childcare, weekly phone call. Like Linda mentioned, we've worked with child welfare leaders and frontline staff in jurisdictions across the country who believe in and see these benefits of kinship care through their own practice and support of families. Shireen's going to drop a couple quotes from them in the chat right now. I want to talk about one of them. I will never forget the case manager who we were working with that looked me in the eye one day and said, Emma, at the end of the day, I believe in kinship care because of the one thing that we just keep seeing over and over again. And that's even when kids are placed with the nicest foster parents, what do? They still go back and they look for their family. And we also know that even when staff believe in the importance of kinship care, there's still a lot that can delay or prevent a kin placement from actually happening. So today we're going to talk about some ideas for changing culture and practice to better address what can still feel challenging about placing with kin at times. And yes, next slide is great. On this next slide, you will see how we are kickstarting this is we're going to jump into a whirlwind tour of sorts of 6 actionable strategies for increasing placements with kin. And as we do that, I hope you'll consider which approaches might be relevant for your agency as you grow in your kin first practices and supports. We know that prioritizing kin placements has not always been the norm. Change takes time. And even with kin first policies in place, jurisdictions often need to take additional steps to translate those policies to change in the day-to-day processes that set up staff to lead with a kin first approach, and in order to really move the needle on making more kin placements. So this set of 6 strategies are what we've seen really making a difference in the ways that child welfare leaders and agency managers support kin families and empower their frontline workers to make kin placements the norm. And so, like I said, this might feel like a bit of a whirlwind. That is okay. Save the link to our website that provides more details and resources on each of these strategies. We're going to drop that link in the chat right now. Oh, thank you. And so Shireen's dropping that in the chat. Also, keep an eye on the chat throughout the entire call. We'll be sharing important pieces for you to read there as we go, and also invite you to add your own thoughts and comments as we continue. I'll pass it to Linda to go over our first strategy on the next slide.
Thanks, Emma. The first big thing that we're thinking about is measuring and communicating the benefits of kinship care, really to strengthen your culture and set the stage for making practice changes. We know that building a kin first culture within your agency, it really takes time, which is why how we're talking about kinship care and keep talking about it is really crucial. Not just thinking about as it's coming up in conversation, but really intentionally creating regular opportunities to be measuring and chatting with your agency teams about kin first placement trends and sharing stories that are coming up in the field about the benefits of these approaches. And we really see that this is critical for raising awareness and cultivating buy-in among frontline staff, among supervisors, maybe for staff who may have lingering doubts or hold preconceptions about placing kids with kin. And so some of the strategies that you can be thinking about within your agency teams are, how can you be using existing meeting touch points or training touch points as opportunities to continue emphasizing the benefits of kinship care for your teams? You can model these conversations in full team settings or make kinship care or placements with kin an agenda item anytime supervisors are checking in with their staff. Second, thinking about tracking and reviewing and discussing kin placement data on a regular basis. We know you and your teams are looking at lots of data all the time. How can you really be incorporating these placement trends into those existing conversations? Maybe thinking about how often are we placing with kin now? How long is it taking to be making those placements? Talking about those things as a team can really help bring staff together and troubleshoot challenges that are coming up. I'll preview a little bit. This is more on this in our next week's session. Finally, thinking about ways to make it really personal. There's a difference between saying, here's what the research says, or saying that something matters, and telling a story that's really powerful that your audience can relate to. And take time to hear from staff on ways they've maybe gone above and beyond to make up kin placement, whether it worked out or not, and celebrate all of the hard work that went in to identify and engage and work with kin. Make the time and space at other meetings and invite staff to be sharing the stories from their work, to be lifting up those insights and reflections to agency leadership. We'll dive into this a little bit more at the end of today's session as well. I'll hand it back to you, Emma, for the next slide.
So we see that even for agencies committed to being kin first, the process of placing a child with a licensed resource family is often still more straightforward than making a placement with a relative, especially when it comes to making an initial placement. Without tools, training, and really clear guidelines on ways to prioritize identifying and engaging kin early in an investigation, the reality is that children may end up being placed with licensed resource families or at least temporarily sheltered by default, even when there could be willing and able kin or nephrons available to support. One way that we've seen jurisdictions, or we have seen jurisdictions reduce the likelihood of this happening by implementing some different tools, things like a kin search checklist for staff to use early on, also implementing stronger accountability checks, things like requiring local directors to sign off anytime when making a non-kin placement. And so the tool that you're looking at right now on the screen is an example of a resource that we developed with one county to prompt staff to build out and document a child's school relative and nephrom network pretty early on, starting prior to the point of a removal decision. And then having every staff member who touches that case using and contributing to updating that log and making it even more and more robust in time. And this practice changed a lot for them. They found that starting earlier and having everything documented all in one place set them up to make kin placements faster later, if needed. But maybe even more importantly, it changed their priorities and process. So they now keep a much larger network of connections engaged in supporting their kiddos in care. And that was a really big culture change, right? From going from a single placement mentality to a network building focus. If we go to the next slide, and our next strategy focuses on breaking down barriers to placement with kin. And we also see that many potential supportive caregivers are commonly dropped from consideration from the get-go for a variety of reasons. Maybe this is sometimes due to financial status, background check policies, or an assumption that they won't pass some of the RFA requirements. But, we should really be norming that it is both likely and understandable that kin families may need extra support up front. They're often being asked to care for a child with little notice and limited resources. So on paper, it really doesn't make sense to hold kin to the same checklist as a resource family who opted in and planned for this. We've seen all the benefits that kids can get by maintaining connections to family and culture. So we really need to prioritize and work to make those existing connections possible whenever we can. Proactively putting structures and resources in place can help address these upfront barriers and support staff in prioritizing those kin placements. So some ways to do this. One, dedicated resources to addressing concrete and financial barriers, like having basic needs items available for potential kin caregivers during the home assessment process, can help. And, really thinking about this on a case-by-case basis and doing your best to get creative when we can, nor going the extra mile upfront to facilitate a more stable kin placement later on. We've seen jurisdictions do some really creative things like get approval to pay for a storage unit and a safety deposit, sometimes even a first month's rent, to help a kin caregiver move into a larger apartment to care for a sibling group. You can also think about establishing really straightforward protocols to request exemptions for prior child welfare or justice system history for kin caregivers. We hear this as one of the most common barriers for placement and one that we know disparately impacts our communities of color. So a really important one to consider. I'll pass it to Linda to go over the next strategy on the next slide.
Thanks, Emma. I'll share our last strategy, really thinking about the placement process, and welcome folks to share reflections in the chat or practices that you've seen to be effective. Feel free to chat us with challenges that you're struggling with in your jurisdictions too. We know through this work that it can be really tough for staff to have sensitive conversations with parents about the potential removal of their children, and particularly as you're thinking about the experience of newer staff on your team. Because of this, we've seen that many staff may shy away from some of those conversations that really allow parents or children or their networks to be sharing their preferences and reflect their decisions, their perspectives into the decisions that are being made. Sometimes we also see maybe staff are trying once, but not then creating opportunities to come back to those conversations, to circle back and follow up. Parents and children may have more to share with time. I really want to encourage you to be actively inviting parents, youth, kin, to be sharing their perspectives throughout this placement process. That work will really promote mutual respect, offer children and families a greater sense of control over what's happening. It can also help to build trust with family members and cultivate a strong network of support around a child that can be really critical for setting a placement up for success. The easiest way to do this really is to start as you need to go on, really to do so from the beginning, thinking about ways to hold family team meetings or other family involved meetings prior to that moment where a placement decision is being made or where that removal is occurring. We know that's not possible in all cases, but making it a goal for those family team meetings to be happening more often prior to that initial placement can make a big difference. Also thinking about training investigative staff, especially all staff on your teams, to be asking about and documenting those family preferences so that all of your team members who may be involved later on in a case are respectful of families' time and not re-asking those same questions. We've also seen counties provide trainings for staff to really stimulate some of this experience with supervisors modeling conversations that may occur between a case manager and a parent or a case manager and a child, really giving their staff the chance to provide feedback and share best practices that they've seen in those situations for ways to be engaging families and youth. On this slide, we've included a sort of list of questions of conversation starters of what we've heard from staff that we've worked with, the questions they found really useful, particularly in thinking about ways to build rapport with children or with teens, and how to be engaging youth early on in those placement decisions. In the document we share, there's a longer list of questions like this, and it's a resource that you could be adapting and sharing with your teams and adding to. And let us know if you add questions to that list of the things that you found really helpful that are missing.
Before we get started on the next strategy, I wanted to call out because I'm seeing some great things in the chat. Thank you all for being active and sharing. As we were talking about breaking down barriers or ways to get creative, it sounds like you all are already doing some of that in your own practice, and things like loaner beds and cribs to help new kin caregivers get able to take a placement and get started. Things like DoorDash, gift cards, and other gift cards to help pay for groceries. Love that list and love the collaborative nature of that. So keep on sharing if you have them. Thank you so much. This next strategy that we're talking about is really focused on providing tailored resources and services to support and stabilize kin placements. So if you do make a kin placement, how are you and your team setting them up for success with supports from day one? Actually, can we go back a slide? I'm sorry, I think we're off one. Oh, no, we're right. I have a delay. Perfect. Okay. Let me ask my question again in that case. So thinking about making a kin placement, how are you and your team setting them up for success with supports from day one? Are you anticipating and honoring how their needs will most likely look different from traditional resource families? Are you thinking about this? Are you adapting accordingly? I'm asking because we often see that even when existing resources are extended to kin caregivers, the supports and services may not be tailored to meet their unique needs. I'm thinking of things like generational differences of older caregivers, interpersonal challenges with managing parent relationships, even things like legal advice. Your proactivity in connecting kin families to existing community resources can make a huge difference. And that's to say, even if you don't have every single resource they need, we know that's a reality for you all, but focusing on what they need to just get started as a new caregiver in a time that we know can be really overwhelming can make such a difference. And really, instead of just telling them about what's out there, helping them take that first step in accessing those supports. It's the same for me. I can have someone tell me that a doctor or a dentist exists, but if they actually, and I know I should go, but if someone sits down next to me and makes that call or forces me to make that call, not saying you should force anyone, but if you are actually able to proactively help get folks started, that's just naturally so helpful and so supportive and makes a big difference. And that proactive mindset also applies in helping new kin caregivers navigate the actual child welfare system. One way to do this is to have processes in place to check in frequently on new kin placements. So adjusting to new routines as a kin caregiver obviously takes time, and not all needs might show up from the start, right? It might take time for folks to know what they need as they get settled. This is a scripted phone call survey from a jurisdiction who made it a practice to call all new kin caregivers 30 days following placement to check in with them. Now, in these calls, some caregivers ask really specific follow-up questions or following out about a specific support or help in accessing said support. And others really just appreciate the call to have a listening ear and being able to talk and share. Formalizing monthly points of contact with kin families can provide them with ongoing emotional support and could proactively address challenges that might otherwise cause a placement to break down in time. All right, now the next slide, please, and I'll pass it back to Linda.
We know that it's not always possible to place with kin as children's initial placement in care upfront. But when that happens, if that initial placement isn't made with kin, we know it can be really easy to lose momentum around continued search. Right at this point, a child or a sibling group are safe in a placement, right? We know that staff have so many other demands and responsibilities on their time in a case, and that can leave limited time for continuing to identify and engage those potential kin supports or potential placement options. And so thinking about ways that you and your teams can create opportunities to pull back up and continue to build and maintain momentum around those continued search opportunities can be really critical, right? As you're thinking about handing off a case into ongoing or into case management supports, some of that initial upfront information from the investigation or around prior kin search efforts can get lost right through those handoffs or buried really deep in the case notes. So I want to hear in the chat also how you're thinking about engaging and encouraging staff to continue reaching out to kin throughout this process. One way that we've worked with jurisdictions to address this challenge and keep that information from getting lost and really maintaining that momentum is by establishing a monthly touch point, right? Where you pull up and you talk about a subset of cases where children haven't been placed with kin. Right, in meetings, you're bringing together key stakeholders. Maybe that includes county leadership, supervisors, managers, caseworkers. Maybe there are other staff like family finding specialists or other service providers that you want to bring to the table to meet and discuss progress being made on those search efforts. Troubleshoot together if there's a challenge that's coming up. that may be keeping a kin placement from happening? Is it a childcare barrier? Is it a transportation barrier? Do we need to be thinking creatively about the ways that our service providers can be supporting children and caregivers and their families? On this slide, we've highlighted some meeting materials and some sample questions that one jurisdiction uses who is having these kinds of conversations regularly in their work. Some of the ways that they've really found that this process has helped strengthen their ongoing kin search and placement processes to be able to identify and place kids with their kin later on in a case are, right? This just creates a sense of accountability. If you've got a meeting, you're going to show up for it, you're going to prepare, you're going to think about it. It's on your calendar, it's happening no matter what. And so this team knows we're coming to this meeting, here's what we're going to discuss. It stays top of mind both during that conversation and throughout the weeks in between conversations. They've also really set a tone and a culture where it's not about blaming or finger pointing about who did what or what steps might have been missed, but it's really a collaborative space, all working towards what is it going to take, what is it going to look like to make placement with kin possible in this case? How can we be brainstorming together? How can we be identifying next action steps? You know, maybe there was an aunt that we talked to several months ago. Let's call her again. Let's see where she's at. Maybe now might be a good time to re-engage her or consider her as a placement option. Really aligning on those next action steps, following those threads from earlier search efforts. These conversations, by bringing folks together in a room, also help leaders understand how our existing policies impacting the ways that our staff are able to identify and engage and place with kin. What barriers are we often seeing that are making it challenging for staff to make those placements? And how can we be celebrating the efforts that staff and caseworkers are taking to engage kin and work on these efforts, even if they're not resulting in a placement with kin?
And before we go on to talk about communicating the benefits of kinship care, I was wondering if, as I'm reading the chat, and if I could, Diana, if I can call you out. I know Diana personally, I would not do this otherwise. But Diana, you shared a little bit about how something that you all have done as a team in connecting with current caregivers to hear more about what they wish they had known or what. Do you want to voice that over for the group and share a little bit about what you've done and what you've learned?
Sure. And I can't say the practice has grown since then because Ellie would know better than me. But when I was a placement supervisor in one of our regions in San Diego, we worked with our Quality Parenting Initiative group and we had those monthly meetings and we just asked our caregivers that came. Sometimes they were relatives, most of the time they were licensed foster parents. And we said, what questions do you wish you would have known? Like, you don't know what you don't know. And this can all be really confusing. And the last thing we wanted to do was just pile everything on a new caregiver at the same time. So we said, let's map it out. Like, what are the questions that you wish you would have known? And then the next meeting or the next couple meetings, because it took a couple, we said, okay, can you prioritize these? Which ones are the most important? Like, is it to know about the physical that needs to happen? Is it about some stabilization services? Like, which ones do you think are the most important for that first week? And which ones are the most, like, which ones would be important week 2, week 3, week 4? And then in our placement team, we had some workers, social workers that we called QPI workers, and we had them assigned to each new placement, whether it be a resource family or a kin family, either one. And we used those questions. And we, at the first week, we said, hey, we just want to see how things are going. And here's a couple of things that we want to make sure you're aware of. And opening up those like prompts and those questions. In week 2, week 3, week 4, we did that for all of them. And then the other hope, and it didn't always happen because the system was not perfect, was that after a child left, we would also try to call them and say, hey, we know that child's left. We just want to see how you're doing. Is there anything you need from us? So that we could kind of continue to have that relationship and to continue to grow that practice. Again, it was regionally based, and we had tried to I know they started to try to pilot it in another region as well. But I just think it went a long way with developing and continuing to keep our caregivers as a part of our team and not just a caregiver of a child.
I love that. Thank you for sharing more. And that's really, I feel like what you shared really connects in relation to what we heard and learned from our jurisdiction that we were referencing that did those follow-up calls where, sometimes even if folks didn't have anything specifically that they needed, they never did not appreciate said call, right? And being brought into a conversation and process. And then what you shared in terms of really empowering their voices by learning from and being able to adapt and tweak to better support future caregivers. That's really key and really inspiring. Well, thank you. Thank you for letting me call you out, Diana.
No problem.
I next would like to, this kind of concludes our whirlwind tour for now. If we go to the next slide, and again, want to reiterate that everything that we just talked through is on our website in more detail with additional tools connected to each of these strategies. So please take your time digging around in those materials, particularly around pieces that resonated with you and what you're thinking about and working on in your agency. But we're going to circle back to the very first strategy that we shared, which is communicating the benefits of kinship care. And we want to give you some practical tools to translate these ideas into action within your own county. So we are dropping a link into the chat right now. If you click on that link, it will open up to a PDF titled Building a Kin-First Communication Strategy. And once you do, you will have a personal version of what you see on the screenshot right here for you to download and use at your own disposal, but we'll get started on it today as a group. And this activity should prompt you to consider how you can further communicate the benefits of kinship care across your county to different audiences. And thinking about what are the ways that I can communicate or talk about this that will really resonate with folks. And just like what are certain pieces or what are certain things that have really resonated with me. And then take the time to brainstorm on ways to create regular opportunities to keep talking about it, right? It's a marathon, not a sprint when we're talking about building kin-first culture. So how do we think about continuing to talk during existing touch points to keep building that kin-first culture? This planning tool is designed for you to use to prepare for meetings, conversations. You can use it with program staff, managers, agency leadership, bio parents, community-based providers, or another external stakeholder that you have in mind. And if you're maybe feeling stuck or you want some inspiration on how to use this, if you scroll down to page 4 of the PDF, it gives an example of someone actually filling out the table and using it to plan follow-up conversations across their team within their organization. And if you're already scrolling and playing around, which I hope that you are, then on page 3 of the PDF, there's also a link to the Communicating the Benefits of Kinship Care PowerPoint. That's also on our website. You can download that from the website and adapt the content for your local context and local use. You'll recognize some of the slides from our discussion today. Again, feel free to use and tweak as helpful as we support you in equipping you to continue this conversation with a larger group. And so what we're going to do to get us started today, we're going to spend a little bit of time in breakout groups with a smaller group of your peers in a format that should make it really easy to have some good conversation and hopefully spark some new ideas. And we hope that you'll use this time to first share out about why you personally believe in kinship care, and then also take the time to transition to talk about how you might think about communicating these sentiments to a group of folks in your own county or agency. You can be as specific as you want or feel equipped. Use this as your time. Shireen is dropping your group discussion questions in the chat now, and these questions will help prompt you through and guide that conversation, but also feel free to use that PDF to start taking notes within your own personal reflection portion, which is up at the top. And again, I hope that you will consider continuing to build out this kin-first communication strategy following this call. But this should be some time to help you get started. You'll have about 13 minutes in your breakout room with a smaller group. And if we can go ahead and open up those breakout groups, we should be good to go.
So first of all, it was just myself and a parent partner in our group, and we kind of got off on a tangent at the beginning, as it always happens with me. But we were talking about just the families themselves and the interactions between the families, the interactions between the staff and the family, right? And we talked about a lot about using empathy and how people forget that piece and aren't like willing to give the parent a chance to come through. So it's a kind of a double-edged sword of how much help can I give you versus how much empathy do I use? So we're talking a lot about that. And when we got around to talking about kinship itself, obviously I find it unbelievable that somebody would think that it wouldn't be a good idea to place with a family member, but culturally speaking, number one, that's what we want. They're the people who know the child best. They're the people who were in the environment the child was raised in. So those are really important things as to why wouldn't you want to be with family? And then the other thing we talked about right at the end, and then I'll get off my little soapbox, is that we're always so tied to our labels and our boxes and all of this. And honestly, who am I to determine what somebody else's family looks like? Who are you or whatever, somebody else to tell me who I can call family and can't call family? So to me, I feel like broadening our horizons with what we consider kin would be beneficial to everyone. Yeah, that's all.
Thank you so much for sharing. Yeah, kin can mean lots of things. Would anyone else want to share something from their discussion?
Hi, I'm from Ventura County. I was just sharing with the group. I think in a general sense, we actually have a good chunk of our kids placed in kin care. And we do what we call non-related relatives. So we call them nephrons. So we figure out who is that person's kin. A lot of the times we actually don't have that many regular resource homes. I mean, we have them, but we it feels much less than what we used to have. But I think one of the things that I do see is something that needs to improve on is really once a child is placed with a relative or kin or nephron, is just the follow-up piece. I think between, at least the way our county works, we go from our emergency response to our court unit or ongoing unit, and a lot of times that emergency response just kind of like leaves them and goes. We did all the paperwork, and then like it's up to court unit really doing a lot of the follow-up stuff. And I think a lot of that gap, even though it's usually only 3 days, it feels like a lifetime. And then those like monthly conversations of really trying to continue to explain our process and what we expect. Like I actually just had a case as a supervisor not too long ago, and it's like explaining to that caregiver, like it was an aunt, and I was like, I know we dropped a newborn on your door and we appreciate everything you're doing, and like thank you so much, and like really trying to get her to like understand what this whole scope looks like, I think is something that doesn't get explained enough. And thank yous go a really long way. But I think that's the other piece, like for us. And then for me, I'm a centralized assigner right now, so I see all the cases in our county, and it's one of those where I think the conversation ends at placement, which it shouldn't. I think there needs to be some kind of magical way where we have like a living document where it can just follow a use, and ideally we don't have to use it for 10 plus years, but sometimes we do, and like we do lose track of people, and it's very unfortunate. And unless you have someone who can really case mine, it gets so disconjointed. So I think like those are things I do appreciate, that we do use a lot of our caregivers, nephrons, with our kiddos, but it's also just really ensuring that they know what they signed up for, because most of the time they don't.
Thank you so much for sharing. I feel like you're plugging some of the sessions that we'll have coming up later this month about thinking about ways to be collaborating across your team, across multiple handoffs in cases. How can you be thinking about strengthening collaboration and coordination there, and thinking about supports for caregivers, both upfront and in ongoing ways? Yeah, thank you for that. Maybe one last reflection, if anybody else wants to share. Sorry, I know I put the pressure on by saying there could just be one. That's okay. We'll go ahead and wrap up. Rochelle, would you be able to share that last slide again? Thank you so much. Thank you all so much for joining us today for this session. feel free to go ahead and mark your calendar for the 3 upcoming session dates later this month. We hope you'll share these opportunities with your colleagues. We hope you'll join us again. We hope to have lots of spaces for discussion. And again, really thinking about what are those concrete resources and tools that you can be sharing with your teams. Next week on Tuesday, we'll have a session called What is Your Data Telling You? This will be a really interactive session and an exercise where we'll talk through what might you be seeing in your kin placement data? What might it mean? And what might that mean for what you might want to do next as you're really thinking about using data to be elevating gaps and uncovering opportunities for improving placement outcomes. We'll go ahead and share the links. Yes, Marianne, great question. We'll share the links to register for all of these sessions in the chat now. And please turn back to the whirlwind tour of resources that we walked through today. If any of those are of interest for you and you want to chat more, please feel free to reach out. I've got my email on the slide and Emma's email on the slide. We definitely welcome your outreach. We're happy to correspond over email or even set up time to chat one-on-one about anything that's on your mind.